Okay, good morning, everybody. It's Thursday. That must mean webinar day. So I want to welcome everybody. Today, we're talking about a different topic. No PPP, at least for today, but that might be coming back soon. We are talking about, should I come back? Can I come back? And how do I come back? Whole topic on re-entering the workplace. Now, before I want to give a little bit of a caveat here, especially as it helps to try and help our presenters. What we say today is in effect as of 8:31 on June 11th, 2019. I have a sneaky suspicion at 8:32 the laws are going to change. Okay, but honestly, the information today is that we're going to provide is going to be try and be as helpful as possible. But the rules are changing on a regular basis. As of Monday and Tuesday, we couldn't, in New Jersey, we couldn't do anything. All of a sudden, as of Wednesday, now we can start doing stuff. So especially in New Jersey, things are changing very rapidly now. So what information we'll give you, it might relate mainly to New Jersey, especially if you're out in another state. You have to be careful. You should talk to your advisor, reach out to these advisors, engage them specifically to help you out. But we just want to try and give you some information. Most of our comments will be focused around New Jersey. We'll probably hit other areas, other states. I don't know if we're going to be hitting global issues. I did see Russia's count this morning, but I don't know if we're going to be addressing that. As you know, we do every week. We have 4 polls. I will ask them to make sure that you are attending the presentation and you can get your CPE if you need CPE. I should have asked earlier. Let me ask a quick question. Please type in the question box where you're located, the city you're in, just so I know that you can hear me. Otherwise, I have to go through the whole presentation again. Barry, you're one of the first to answer all the time. Good to see you. Okay, great. We got a lot of people. Same towns. Ken, morning. All right, so we have 3 presenters today. Hopefully you saw in your the flyer that you sent out, Dr. Eric Handler, Tina Handy, and Justina Abrams. Dr. Eric Handler is a board-certified emergency medicine physician. He works as a medical director of operations in the emergency department at St. Barnabas Medical Center. He oversees the department and treats approximately 1,000 patients a year. Tina has worked in New Jersey commercial real estate for over 25 years with experience in Class A buildings, retail, shopping malls, strip centers, multifamily, and flex warehouse space. As a director of asset management for SJP Properties, she handles business development and management team of 25 engineers, managers, and administrators for Class A portfolio of 6 million square feet. And Justine Abrams is an attorney with the law firm of Genova Burns. She is Genova Burns Employment Law and Litigation Family Group, Human Resource Counseling and Compliance Practice Group. Oh, and Cannabis Industry Group. I don't know why that comma got in there so well, but anyway, and that industry I know has been getting hit with this whole coronavirus too. Anyway, maybe that's another webinar we can do. Half of her job is litigating all types of employment law cases, representing employers and management in areas of discrimination. The other half of Justine's job is providing counseling and training to employers for the members of management on how to avoid lawsuits to begin with. That's probably the best way to avoid to not have to pay on litigation, is just avoid the lawsuit. So I strongly recommend training in that capacity. So let's kick it off. Try and watch the time. Before I do, real quick, let's do the one poll. The first poll is, are you going to require your employees to have antibody testing before or during, before entering the workplace? Oop. I just cut it off? Oh, well. If you saw it, you're done. It's done. Anyway, all right, let's get into this. Eric, so I've been sitting home for 12 weeks now and going crazy. So this is not a mental health session. You're a medical doctor.
Yeah.
And dying to go back to that office, and I'm hearing a lot of people saying the same thing. And I think that some people are just bored at not bored at home, but they don't have that outside activity that keeps them, going on. Should people be running back to the office or back to their place of employment medically?
So, yeah, I'll let my two other panelists, if they wanted to answer that question from a legal and just logistics standpoint, but from a medical standpoint, just because, and I tell my patients this when it comes to medical treatment in general, there's lots of things we can do that doesn't necessarily mean we should do them. So June 22nd, apparently, you can start in some fashion as per the rules returning to the office space. That doesn't necessarily make it the best idea. There are still going to be challenges with social distancing, making sure that all the logistics are set up to keep people safe. So whether or not people return to work the day that they're allowed, again, I don't know that I would necessarily recommend that until the proper protections and logistics are in place. And that said, this may show people that things that used to have to be done in a brick and mortar building don't necessarily need to be done that way anymore. The flip side to that argument is there's a huge social component to going to work. Just like for kids, most children will tell you they don't necessarily enjoy the schoolwork of going to school, but they sure do love seeing their friends. And that's been the hardest part. I can tell you from watching my two children that's been the toughest part, is not being able to hang out with their friends. And as adults, we've got those same social needs as well. So I understand the drive to want to return to work, but want to do that safely and in a smart fashion. So I would say until employees get that sense of comfort that those protections are there, you don't need to go running back in. And it may be some staggered fashion as well. So there's a group A, group B, group C, and there's some sort of rotation in that regard to, again, allow that spacing and keep people safe. We have, thank goodness, been seeing a significant decline. I can speak to Barnabas and my colleagues that are at some other local hospitals, a significant decline in the number of cases. And we were admitting 60 plus a day. Past few days, we've been admitting 11 patients a day. So, as long as we can keep that steady state and not get overwhelmed, this is a doable situation. But again, having everybody rush back into the office does put us at risk of having that number increase again.
Yeah, just because the state says that it's opening doesn't necessarily mean it's safe to be running back, right?
Correct. And there may be ways to make it safe, but we need to get that sorted out before everybody just starts jamming themselves in the elevator.
Well, and speaking about jamming, and it's unfortunate, I watched on the news this morning, they showed the testing, to see them do with the nose. And should people be getting tested before returning to the office?
My personal opinion is going to be no, because let me explain why I say that. So you need to be sick pretty much for about 5 days, or have had virus in you for about 5 days before the test is going to be positive in the first place. And this is for the PCR, the one you were talking about, cramming up your schnoz or spitting into a tube. So you could theoretically actually still be shedding virus and test negative. The other problem is you could have been sick during this 12-week period that you just mentioned, have recovered, and now you've got dead viral particles in your nose and the back of your oropharynx, which is the medical term for the back of your nose and mouth, and that will still turn the test positive. So I know colleagues, our nanny, all had coronavirus. My nanny did not get it from us, by the way. She had been home. I'll throw that out there. But to the employment attorney, but she tested positive for another 10 weeks after she had been fully recovered. So the PCR test is extremely sensitive. The way it works is it takes pretty much you only need about 200 copies of it could be dead or alive viral particles, and then through the technology that gets replicated to the point where the test can be done. So very, very small load, and it doesn't have to be full alive virus will make that test turn positive. It's been a challenge in the hospital as well, because you have patients that, they're recovered, yet they're still testing positive. So some of the nursing care facilities won't take them because they're still testing positive. So it can complicate things. That's the short answer.
So somebody asked the question, when do the antibodies kick in? I don't know if that's that might be a
Yeah,
medical term, kick in.
yeah, sure, 100% medical term. Yep, use it all the time. No, but so you, after 2 weeks of exposure, so you need a good 2 weeks before you're going to start making antibodies. And some people, for one reason or another, we're starting to see, don't, even if they were sick for some reason, do not mount that response to where they're making antibodies enough to make the test positive. And so that was, I'm sure that was going to be a next question. Should they get antibody testing as well? And I would tell you that is not a good way to see if somebody, number one, still has active infection, because the antibody test that is not FDA approved, but got permission to be used is IgG. And that only tells you if you've had an infection in the past. It does not tell you if you have active infection. That is IgM, tells you if you have an active infection. So it just means that you had it. We don't know what protection that confers to a patient as of yet. The studies still need to be done. And just being antibody positive doesn't necessarily mean you've got that protection to enter the workplace and not get sick again, nor does it mean that you can't get somebody else sick, because again, you can have antibodies but still be having the infection itself. So until you're clinically better, you should be home. And I'm sure that we'll get into a whole nother slew of questions.
Yeah, and I'm sure some people are going to try and cut corners, and well, I'd be happy to try and administer the test on the staff, but my wife wouldn't even let me take the kids' temperature, so I don't think that'll happen. People are going to try and cut corners. I'm sure that use of proper medical professionals, this is probably for you and Justine, proper use of medical professionals is strongly recommended if you're going to do any testing or administering.
Yes. And I would also tell people to be leery of the finger prick tests that have the IgG, IgM combination. There are, before the FDA got caught up with making more rigorous standards, there were a lot of, knockoff isn't the right word, but for lack of a better word, knockoff tests that were not properly vetted, and they're still circulating out there, and huge high false positive and false negative rates. The other reason that leads me to another point of why people should not get antibody testing, just quote unquote to see. Right now, the prevalence of coronavirus in the United States is about 5%. So when you look at the formulas that allow us to put together what are called sensitivity and specificity of a test, sensitivity is, does it capture people that actually have the infection? And specificity is, if the test is positive, does it really mean it's because of that illness? So when you have a prevalence of only 5% and you have a test that is, I'm going to say 95% sensitive, and to the general public, 95% sounds really good, right? But if it's only 95% sensitive, when you have such a low prevalence of a disease, you're only talking about getting it. You can have a false positive rate of almost 30%. So now somebody thinks they're positive when they're not. They're like, oh, I've got antibodies, I'm okay. Let me run out there and shake hands and get spit on and go see my family. And then they themselves get sick. So it's really been an issue in regards to what people understand about this test. Now, there is a test that has a 99.5% sensitivity, and that is the one that if you go to the doctor's office, they're drawing your blood, it's getting run on the Abbott machine. So even at 99.5% sensitivity, knowing that there's only about a 5% prevalence in the country of the disease being out there, you're still getting a 14 to 15% false positive rate. So that's better than 30%, but there's still, again, you can't definitively say if you get a positive result, that definitely means the person had antibodies. So we've had colleagues that have been in quarantine, never got sick, then came back to work. Literally 2 days after they came back to work, the facility started offering the antibody test. They got it done, and they came back positive, when there was really no way ever for this person to have come in contact. She was on maternity leave anyway. She was holed up in her house. They never left. So, it's the antibody testing is not necessarily where it needs to be just yet to be used for employment purposes.
Hey, Brad, just to address your question about should we have a medical professional be doing these tests at work?
Please. Yeah.
So from an employment law perspective, and just to give my disclaimer, nothing about what I say today is legal advice. I am a lawyer. I'm not your lawyer. This is just a summary of the issues. It's an interpretation of the law. It's not advice, and it shouldn't be construed that way. Anyway, I have to say that the test, temperature check, the medical questionnaire should be done by someone other than the employee's supervisor. That is somebody who can make tangible decisions regarding the employee's terms and conditions of his or her job. So if it's not a medical professional that you're hiring to come in to do it, maybe it's HR, maybe it's the office manager. And that's because of the Americans with Disabilities Act's confidentiality requirements. We want to make sure that any access to medical information is limited access. And it's better if you have a non-supervisor do it, because once a supervisor has knowledge of an employee's medical information, that knowledge is imputed to them for purposes of any employment decision they make regarding the employee. So if, let's say, that supervisor a year from a month from that test fires the employee for performance reasons, and there's no documentation about this employee's performance problems. What there is documentation of is the employee's temperatures and the employee's symptoms over the course of a month. All of a sudden, that supervisor is now imputed with potentially disability-related knowledge. And so what's the employee going to say, especially without documents, right? Because the employer is seen as having the competitive advantage when it comes to record keeping. So when there are no performance documents, who wins? The employee. You fired me on the basis of the fact that I had COVID-19. You fired me on the basis of the fact that I have an underlying health condition. Mm-hmm. Supervisor knows about the medical information. The supervisor can be held accountable for making decisions on that basis. If you have HR or an office manager, somebody who's not, doesn't have the authority to make those decisions, you're in a much better position.
Yep.
Sounds
and I'm
like
sorry,
yeah,
you had frozen for just a moment when you asked the question. So I didn't realize the question was, should a medical professional be the one doing it? I think that unless you have somebody already on site, I don't see that as being necessary, and probably a cost that would be able to be better used somewhere else. Again, we're not talking about high-tech equipment. We're talking about a thermometer, and we can get into that conversation, and
right.
a quick questionnaire.
Okay. Tina, were you gonna say something?
Yeah, I was just gonna circle back to the first question. Dr. Handler said making safe and smart decisions, and I can say from a landlord's perspective, everybody has been readying their buildings to welcome back employees. For the most part, they've been open this entire time, because just because the governor issued an executive order doesn't mean the building stopped functioning and the air stops running. So people have made changes to the signage in the building, ingress and egress. We have changed occupancy in elevators, put up signage for face covering requirements, reminding people to practice good hygiene in the bathrooms, adding disinfectant stations, wipe stations, hoping that when people do come back, we've given them the reassurance that we've created this safe environment for them. Some of our national and international tenants are doing temperature testing, whether it's thermal imaging or just holding up a shotgun to your forehead. They are using that as a measure of allowing people into the environment again. And they are also doing the well-check questionnaire. I can say for certainty that our own company is going to be utilizing a well-check app where you answer the 5 questions that you've seen on the CDC website. Are you sick? Have you been traveling? Is anybody in your family sick? Do you have a fever? If not, you can come to work. And that's how they're going to keep track of it.
Yeah. And when you look at studies that have been done in the past, when it comes to medical issues, things like this, people typically do the right thing. We're used to flu season. If you have a fever, don't go to work, try to stay home, be fever free for 72 hours, that type of thing. Since we've been touching on the thermometer a few times, my caveat to that is a couple things. One is most people are using the scanner. What you refer to as the shotgun is still somewhat an infrared thermometer.
That's thingamajig.
Exactly. Those things, and just taking a temperature to begin with has its own limitation. So when you look at the COVID-19 statistics, on presentation, only 50% of patients have fever initially. Now, once you get into day 4 and 5, that's when they start spiking a temp. You're shedding virus those first 4 or 5 days before you have a fever. So you know, it's not a great way to prove that somebody isn't necessarily ill and putting other people at risk. The other issue with the thermometers, and I made the joke when we were doing our pre-call, I get
But
out of
it's
my
such a
car.
good point. It's such a good point in the summer.
I get out of my car, which has been having air conditioning blow on my very hair-heavy forehead here, and I walk into the building. It takes me 10 seconds to walk into the building. I really haven't gotten my skin temp back up yet, and every time I walk into work, it reads 96 degrees. So, you know, they do have their limitation in regards to, you know, if there was a different temperature blowing on somebody's skin right before you take their temperature.
Now, if somebody had the virus already, are they immune from it? I mean, have the medical professionals ever determined this yet? Or we don't know
Nobody
still?
knows. Yeah, nobody knows. Look, just going back using actual medical knowledge, if you develop antibodies to something, that confers some protection. Exactly how much and how long, that is still not known. The reason why we have to do a new flu vaccine every year is because the flu virus itself mutates so quickly. So every year it's the best guess of what's coming out of the other part of the world to vaccinate the West world. Not the HBO show. The coronavirus does not mutate that quickly, so that's why we have not seen these big shifts in regards to you know, necessarily symptoms or how people are doing with it. Right now, there's probably only 2 or 3 different antigenic versions of coronavirus. So that's why, you know, hopefully once a vaccine is made, it remains useful and not have to be done every year or so often whenever this mutates, like the flu vaccine. But yeah, to answer the original question, nobody knows what protection that confers.
Right. I have to put up a poll real quick, and I'll ask you a question while I'm putting up a poll. But the question for the poll is, and I won't slip and push the button twice this time. Do you have a return to the people? Do you have a return to work policy in place? Now, the one thing I think that this is going to be, Eric, for you and Justine. You know, we always talk about, I'm going to refer to them as the protected classes, you know, and there's certain portion of it, but usually age is part of also one of the protected class too. And now people are classifying them as the high risk class. Should we be concerned about the, you know, quote unquote, high risk class coming back to work? I'm just sharing the poll. Should we be concerned about the high risk class coming back to work medically? And can we restrict the high risk class coming back to work legally? We're like in a tough situation. We want to, what we feel, protect them in some way, but then all of a sudden they can't be treated differently. So should they be?
So I can speak on from the medical aspect. I do think that people, you know, if you look at the numbers, you know, once you start hitting 55 and up, significantly have an uptick in regards to both morbidity, which is getting ill, and mortality, obviously, which is death. So we've had colleagues that are in that age group that are nurse practitioners, a couple of physicians, and they've been home through all this. They're really, it's, you know, you're talking about somebody's life here. Yes, their job is their livelihood, but again, if they get sick and then can't return back to work on the back end, what was the point all along? So we've, you know, suggested, we have not forced anybody to leave. It was actually the employees wanting to go. So the actually making them, I would leave that to Justine to answer that one.
Yeah, so that I just wrote down a question here. Did they ask to stay home or did we send them home?
No,
So,
they asked to stay.
yeah. So the CDC has these 3 categories of vulnerable individuals, right? It's the individuals with underlying health conditions that stand to be exacerbated by contracting COVID. We have the 65 plus, although I just heard Eric say 55 plus, so we'll say the older crew, and pregnant women. And these are these 3 categories. So you're not going to be entitled to a reasonable accommodation that is potentially an extended leave or continued telework. It'll change situation to case by case. You're not going to be entitled to a reasonable accommodation under the Americans with Disabilities Act just by virtue of your age or pregnancy. Why? Because your age or pregnant and being pregnant is not a disability. Now, you could have impairments from pregnancy that could constitute a disability. You could have lung disease and happen to be 65 years old and be disabled, and you just happen to be part of that older crew. But the Age Discrimination in Employment Act, the Pregnancy Discrimination Act, Title VII, these are all laws that protect older people and pregnant women from discrimination, meaning we can't take adverse actions against them based solely on their age and pregnancy. So our inability to send pregnant women home, keep them home because we want to, our inability to send older people home, keep them home because we want to, seems to be a little bit, there's a lot of tension there between those laws and what the CDC tells us. What I can tell you is, based on the EEOC's latest guidance, the Equal Employment Opportunity Commission, people with underlying conditions that fall into that first group, they're going to be entitled to a reasonable accommodation. Asthma, lung disease, heart conditions, kidney disease. Eric, feel free to tell me the other ones. Even people who suffer from something like morbid obesity, who are unable to socially distance themselves from others in the workplace. People with developmental disabilities who are unable to understand certain instructions given to them, you know, stay 6 feet apart from people, you must wear a mask, you must wear gloves. These are all potential disabilities that would entitle somebody to a reasonable accommodation. Now, once an employee requests an accommodation, that's when you can say, sure, you can continue working from home as a reasonable accommodation. You can't ask an asymptomatic employee, do you have any underlying health conditions? You can't. That's going to violate the ADA, again, according to what the EEOC tells us right now. What are some examples of these accommodations, again, that we can offer to individuals who are disabled? Telework, potentially modified PPE, right? We might have a latex allergy, for example. So if we're giving out latex gloves to our employees, we may want to get a pair of non-latex gloves for the individual who's got the latex allergy. Another interesting one that keeps coming up, a lot of employees, especially in the greater New York area, New York City area, get to work by public transportation. What we've been trying to work with clients to do is reasonably accommodate some of these employees, meaning a slight modification in their job, in the terms and conditions of their job, adjust their shift so that they can come in at 10:30 instead of 9 a.m. and travel during times when less people are traveling and less people are on the trains. Potentially offering them subsidized parking. Maybe the reason they use public transportation is because they don't want to pay toll costs or parking costs, right? So offering subsidized toll payments, subsidized parking, potentially subsidized rideshare arrangements. And remember, it's just a temporary fix. And it's not going to be forever, but these are some of the accommodations that we might be able to offer to these disabled employees.
And we've been tracking our tenants' return to work policies, and the majority of them are offering phased return policies, optional return policies in that first phase, also staggered shifts. Some of them are expanding their shifts instead of it being 7 to 9, making it 7
a great
to 10,
idea.
7 to 11, so that you don't have the same density entering the buildings and queuing up into the elevators that you would have had before. But that also, for landlords, may change how long is your HVAC running? Do you need to make it run later? Do your leases say it only runs until 6 p.m.?
I mean, for another topic, for another day, does that run into zoning issues then? But
Zoning with the ingress and egress?
just for the township, what you anticipated hours of this or type of use of property, but that's another topic. We don't have a zoning expert on right
No,
now.
a lot of tenants, yeah, I mean, the majority of the tenants have, full access to the building, at least in our portfolio.
So if you have a person, we have a few departments. I'm on the audit side. If we find out somebody in audit was infected that was in the office, I imagine the best thing is to close down. And I'm going to talk like a real rube here. Is the best thing to do to close down audit? And am I allowed to say, hey, we have to close down audit because Joe was infected, type of thing?
No.
Right.
No.
I wanted that out.
Justine, you want to take it first, or you want? I mean, from a
Yeah,
landlord's
yeah. So
perspective, go ahead.
So here's what you're gonna do. Here's what I'm gonna do as HR for company X that Brad, you and I and Joe work for. I'm gonna call Joe and I'm gonna say, when was your last day at work? Right? When was your last day on the at the facility? Who did you come into close contact with for a prolonged period of time? 2 days before you tested positive or 2 days before your symptoms manifested. This is the CDC's measuring stick here. I'm going to get those names. It's going to include Brad, Tina, and Eric. And I'm going to then contact Brad, Tina, and Eric, and I'm going to say, we've been notified that that an employee has tested positive, that you've come into close contact with for a prolonged period of time, meaning within 6 feet for 10 to 15 minutes at a time, at least 2 days before their symptoms manifested or their positive test came back. We're going to send you home for 14 days or until you get tested and you get a doctor's note saying you're cleared to come back to work. Then we're going to notify the rest of the employees, right? And we're never going to say that Joe was the one who tested positive. We're going to say we've been notified that an employee of ours has tested positive in order to protect that employee's privacy. And because we are required by privacy laws to do so, we're not going to tell you his or her name, but we can tell you that here are the workspaces and the work locations where this person worked. And we can also tell you that those who have come into close contact with this person for a prolonged period of time, 48 hours before they tested positive, have been notified and sent home. That's the type of information we want to tell the rest of our employees, that we're actually required to tell our employees according to the CDC. And what we are prohibited from telling our employees is the identity of that employee. No initials, nothing identifying.
And literally, not even male or female, nothing.
I would say his or her.
Not conspicuously absent from work. Everybody's going to think it's.
I mean, here's the thing, and that's a great point. Employees will talk. They talk. But as long as the message is not coming from you, the employer, right? That confidentiality requirement it can be enforced against you, the employer. You, the employer, are the one who could be sued for it.
Can you be sued? And you can be sued for anything.
You can be sued for anything.
Can you be sued for not stopping the employees talking?
I would imagine somebody could have their day in court on that theory. And in your message, and you know, I can tell you, my law firm, we've put together at this point thousands of these notices, because I don't want to say thousands, hundreds of these notices. But we do have a line in there saying, look, let's respect something along the lines of, let's respect this employee's privacy. You know, our priority is your safety. Let's be a team. Let's work together. Let's not talk ill of this employee. And let's just, you know, make sure that we're doing what we could. We're going to close the workplace for a day. We're going to do a deep clean. Feel free to talk amongst yourselves and talk about your feelings, but let's not talk about this employee. It's really, you know, forget about the ADA, right? It's just, we're a team, right? We're coworkers. We're all on the same team here. Let's not do anything to sort of threaten that.
So
and did anything like this ever happen before when people had the flu? Did you talk about everybody when Joe had the flu last year and sat across from you? I mean, that's what's interesting about this whole.
So unfortunately, in audit, we have a couple Joes. I realized it after I said that, and now I hope neither one of them gets sick. Okay.
Sorry, Joe.
Anybody in the audit department named Joe, I want to make sure that
you're a good sport, Joe.
Okay. But so if the mysterious Joe comes down sick, and we knew he was at his desk or her desk, because it could be a woman, medically, should it be clean? Should the desk and all areas be wiped down? And who generally covers that, you know, pays for that cleaning? I imagine it's the tenant themselves. You know, they don't have to pay for the elevator cleaning or anything, but the desk environment, I imagine, should be wiped down and cleansed, right?
Yeah, when we're contacted by a tenant that they've had a positive exposure, we connect them with the janitorial company, or if they require a full and thorough decontamination with electrostatic sprayers, they may choose to go that route and call in an industrial hygienist who comes in suits and sprays the whole entire suite. It depends on the amount of exposure. You know, if it was an executive A who comes in and goes into his office and only met with one person in the conference room and then left for the day, we may just contact trace and clean those spaces. They will wipe down and clean the keyboards and the mice and do a fine mist spray of those areas, as well as all high touch surfaces as that person entered the building, you know, elevator buttons, bathroom stalls that they may have visited, pantry, etc.
In fact, the latest executive order that came out actually requires that workstations be disinfected when an employee has tested positive for COVID-19. I believe the way that it's written right now, I think it's Executive Order 153, if I recall correctly, the way that it's written right now is that it applies only to certain businesses, and that's because only certain businesses are allowed to open their physical facilities. But I would imagine that that rule, because of how specific Governor Murphy has been with the language in his executive orders, is going to apply to everyone who ultimately is allowed to open. And there was a question that came in about, you know, we're a smaller business, we can't afford to really pay a cleaning service to come in. You know, is there any financial support available to pay for these sorts of things? I'll leave that second question up to the accountants in the room. I believe there might be some tax deductibility there for business expenses. I'm not entirely sure, but one way to maybe try and decrease the amount of times you have to pay a cleaning service to come in, when you work with your lawyer to write your safety policy and your preparedness and response plan, one of the things you want to consider including in there is all employees are required to wipe down, disinfect their workstations every day using these Lysol, Clorox wipes that we provide you, using whatever it is that we provide you. That way, you know, I wouldn't say it should replace a cleaning service, a deep clean service, especially when somebody has a confirmed case, but it will certainly help mitigate costs against having to bring in that cleaning service every day. And if you require them to do it, you know, when they don't do it, they can get in trouble for not doing it. Just make sure you enforce that policy uniformly.
Brings up a good point, because a normal scope of work for cleaning or janitorial in the evening does not include wiping down your keyboard or your desk or your mouse or your copier machine or the stapler in the shared office space. So think about all of those areas that haven't been touched before that now you need to pay attention to. So getting that PPE and disinfectant wipes in place, if you haven't already ordered it, is so important, because some people have ordered it back in March and it's not being delivered until August. So, you know,
light switches, door handles, sink handles, all of those high touch surfaces.
Right. And this is a respiratory, droplet illness, as are many viral upper respiratory illnesses. So this is not unique to coronavirus. And the things that Tina just mentioned are smart things to do every day. Forget coronavirus. You know, you come to your workstation and you don't know who could have been there. You know, why people probably weren't wiping down their keyboards before this is a great question. I mean, this is stuff
Eric,
that
I need to travel with you in my pocket, because I tell my mother all the time, I say, Mom, you're the perfect mother for somebody to be prepared for this pandemic. She has been using alcohol swabs to wipe down our everything since I was 4 years old. I every day walk in, even before coronavirus, and it's because I'm a germaphobe. I wipe down my keyboard, I wipe down my phone, I wipe down my mouse, I wipe down the earpiece on my phone, and I just think it's good practice for purposes of making sure your face doesn't break out with acne, right? To clean off your phone every day. I mean, so to me, it's second nature. But I've been encouraging people to do it all this time. So I guess it's a blessing in disguise.
And I'm the opposite. I'm the opposite. I've never really thought about it before, other than the bathroom, washing your hands, or sneezing and washing your hands, going through.
And those are the two other big things that people coming into the office should understand, that these don't go on this. So this is not something, your biggest organ is your skin. and our skin is what protects us from things. Short of having a huge cut or break in the skin, coronavirus does not wheedle its way down in through your skin and make you sick. That's not how it works. This enters through you touching something, that touches something on your face, and it migrates into your nose, your mouth, or people like to bite their nails, or you go and rub your eye. So, bless you. Any mucosal surfaces, which mucosal surfaces are the red juicy stuff, so the inside of your mouth, nose, your surface of your eyes, that's how it gets spread. So you could touch a doorknob that has coronavirus from today until tomorrow, you're not going to get sick. The problem is people, you don't realize all throughout the day you're doing this. So that's where cleaning things comes into play. But the biggest thing that needs to be cleaned are these. So you got to wash your hands. If you have debris on your hands, it really should be soap and water for a good 20 plus seconds. If it's just I came out of the elevator and I think I may have touched the button, the hand sanitizers work well. This is a very easily killed virus. Almost not water, but pretty much anything plus water kills this virus. So any of the wipes that are out there, it's an easily killed thing. So just wiping down your workstation and then making sure you're taking care of your hands several times a day should protect people.
How about the Purell bottles? I mean,
yeah. Good luck finding one, but yes.
Okay.
No, they're much more ubiquitous now. My local ShopRite they probably have too much now. They can't get rid of it. But the other thing in regards to preventing spread other than the hands is if you have to cough or sneeze and for some reason you're not wearing the mask in the office, which I think is probably still going to be a good idea, you always want to cough and sneeze into the crook of your arm, not into your hands, because now you just put a gazillion viral particles on your hands and you're out touching the world. But I don't know if anybody had discussed, Tina, you can probably answer this question better, had discussed whether people are going to or not going to wear just a cloth or surgical mask in the office.
Yeah. Well, in our portfolio, we are encouraging face coverings required in all common areas of the building. And then once you enter your tenant space, that's up to the individual tenant to determine what their own protocol is, or what their policy is going to be. We have some tenants who are making it mandatory to wear the mask all day long except when eating. Even if you're on a Zoom call like this in a private office, you have to wear a face covering. There are others who, say that your 6 foot space at your desk is your home. You don't have to wear your face covering at home, which is kind of how our office is going to operate. We are not requiring gloves in any way, shape, or form. And you brought up a good point before about not touching your face. People wear these masks, but then they're touching the mask and then they're touching their face. So if the virus was on the outside of the mask, if they're not putting it on and taking it off properly, it's still going to cause some measure of exposure. I want to circle back to what you said about the Purell. While Purell is readily available, disinfectant stations are harder to come by. So for those people who might be on this call who have to outfit their offices with disinfectant stations, be mindful of that and try to find a local distributor who has something. You might want to try a restaurant company, Chef's Corner, places that supply those things to larger corporations. Some people have stockpiled them. I know Newmark Knight Frank has stockpiled some PPE for its tenants. And because the bottles will go walking. I mean, I hate to say this, but anybody who just puts bottles all over their office is disappearing, and people put them in their purse, and they take not purse, maybe men can put them in their pockets.
BYOP, bring your own Purell.
Bring your own Purell. Yeah, exactly.
There's a PPE supplier registry. There was a question sent in about how hard it is to find PPE right now, including sanitizers. There's a PPP supplier registry on the New Jersey State's website. I can send out that link to you guys after the webinar if you want, but it's great. It links wholesalers, sellers, distributors of PPE, masks, gloves, sanitizer with buyers, people who are looking for it and can't find it. It's a really, really great database.
Home Depot, WB Mason, Home Depot Pro, Lowe's, restaurant suppliers, all of these places will say they have them, and then they will commit to getting them to you in 2 weeks, and then 2 weeks later you'll get a
show up. Right. Yeah, right.
So getting your offices safe and ready, like Dr. Handler said, being smart about how you're welcoming back your staff. Get things ordered now if you haven't already.
And
Good.
Yeah, I was going to say, with the masks and gloves in an employment context, under the New Jersey's executive orders, we're pretty much required to require that employees wear masks or face coverings while on the premises. And
That's
we're
right.
pretty much required to require that employees wear gloves when they come into contact with the public or with goods. That's what the executive orders say.
With goods, right.
So sticking, excuse me, sticking, it's the
We
pollen.
all got sick on this call somehow.
That's good respiratory etiquette there, though, Brad, putting your hands up to your mouth.
And I try not to do this. I tried to do
Yes,
this.
there you go. It's better.
Because now I'm going to touch my mouth. But sticking with the cleaning, Tina, you said, most, and I agree with this, most office environments, or most environments even, they're, and I used to do office cleaning in college, just pick up the garbage, dump the garbage, run the vacuum cleaner, maybe dust a couple things. That's it. I'm imagining you can hire them at a higher level, but is it just beneficial for us to train our people what is I'll call it a safe hygiene environment, how to clean your desk when you first enter the workplace during the day and at the end of the day? I used to argue with people when they say people should wipe down their workstations at the gym when they're done. I said they should. I said, why don't you wipe it down beforehand? They said, well, they're supposed to wipe it down at the end. I said, they should. Why don't you wipe it down beforehand? No, but they're supposed to. It's a circular argument. So if you're going to sit down and start doing work, is it probably beneficial for us to have somebody train the people? I don't think you need to bring in somebody, this major disinfectant service, but say, here's how you should wipe down your workstation before you start working. Is that
Well, think about it. This is changing the way some people work. Look at the WeWork environments, or all of these spaces that have densified over the years, and they've had desks on top of one another, and you're 3 feet apart in these call centers. Everything is changing. They have to remove every other seat and reduce the occupancy. Some of these people shared keyboards, they shared desks, they shared phones, they shared headsets. None of that can happen anymore. So I think it's twofold. I think you have to create your best practices for your own office environment, and part of that should be good hygiene for each individual employee, encouraging the cleaning of their own keyboards and mice and everything as they go through the office. Keep getting in the habit of carrying a wipe as you go from the bathroom and touch all those surfaces out and on your way back. And then also speaking to your janitorial provider, because while the day porter will increase, and cover all high touch surface areas in the building throughout the common areas, whatever you're paying for in your lease terms, in your suite, varies. And so if you're going to increase services, increasing services is also going to increase the products used. It's going to increase the amount of disinfectant, the amounts of soap, the amounts of this, the amounts of that. And that should be discussed before you re-enter the workspace, because you may choose to add another porter to your suite to cover the pantry areas, to cover the copier room, to cover the areas that are not that person's desk or office. Some people are bringing in, we have some tenants who are bringing in another half-day porter for the next 30 to 90 days to determine, if that's going to alleviate the fears of their employees. And again, circling back to what we talked about in the beginning, I think here you need to give the employees the option to come back. Some people may not be productive at home, right? Some people may function better in an office environment. If you ask for people to come back, you may get 20% of the people raising their hands saying, I need out, I can't work from home one more day. But then you do have the people with underlying health conditions and childcare issues.
Sure. I have to put up the next poll. People are getting antsy, I could tell. What guidance are you using to create a return to work strategy? That's the polling question. But I have a lot of questions coming in, and I'm just watching the time, and I'll kind of go through some. Might seem random. Somebody asked about returning to work. Is Tina, you just said you have to give them the right to work to come back, or not give. You didn't say it that way. I don't want to say you were expressing it as an attorney. What happens if they can't come back because of their age, medical, as Justine said before? What happens if they have family members that they're nervous about getting sick? I don't know if this is probably more Justine.
And that's a very good question.
Yeah, so if you have a family member who is disabled, but the family member is not the employee, then there's no employment relationship between that family member and you as the employer. And so you're not, I have to be careful when I say this because in New Jersey, this actually is a very evolving area of the law. There can be discrimination against somebody based on their association with a disabled person. You discriminated against me because I have to, stay home and take care of my disabled daughter 2 times a week. And I have to take FMLA, intermittent FMLA leave 2 times a week in order to care for my daughter. Under the law, you're not allowed to discriminate against me on that basis. However, the reasonable accommodation piece only extends to the disabled person as the law stands right now. I don't get a reasonable accommodation because my daughter is disabled. I might be able to get family leave, paid sick leave, because my daughter is disabled and I need to stay home and take care of her. But I'm not going to get an accommodation beyond that because my daughter is disabled. Again, that is an evolving area of the law. In fact, we have a pending motion to dismiss on that very issue right now in one of our cases. Under the New Jersey law against discrimination, you can't discriminate against disabled people. You can't discriminate against people on the basis of their being associated with a disabled person. Excuse me. You have to reasonably accommodate the disabled person, but do you have to reasonably accommodate the person who's associated with the disabled person? Right now, no, and the reason is because the accommodation that those people get is family leave, paid sick leave, New Jersey family leave, potentially New Jersey family leave insurance benefits. Those are the quote accommodations that extend to those people who have family members who might be disabled.
6 degrees of separation, it sounds like.
Right.
If somebody does become sick and they have to, they contract it and they have to take off, are you required to pay them? I know this is more of a legal question.
Yeah, really, really good question, though. So the Families First Coronavirus Response Act, FFCRA, does say that we need to provide certain paid, it's the first federal law requiring certain paid leave and certain paid family leave. There are 6 reasons that we can take leave under this law, one of which is somebody is experiencing symptoms and seeking medical diagnosis. If they're full-time, they're going to be entitled up to 80 hours of fully paid leave. And if they're part-time, it's a number of hours equal to the number of work hours they average on a 2-week period. They're going to be entitled to a number of paid sick leave hours equal to that number if they are experiencing symptoms and seeking medical diagnosis. And that's the Families First Coronavirus Response Act. Now, we can take leave under that law and get paid for it for other reasons, like childcare related reasons. We can't work or telework because we have to stay home and take care of a child. We can't work or telework because we're home taking care of somebody else who a doctor has said quarantine. We are entitled to pay through December 31st of this year. So it was effective April 1st and will expire December 31st. As it stands right now, it might be extended. Like you said, Brad, it's 9/23 right now. Congress may pass a law at 9/24 changing this.
Right.
But right now, through December 31st, yes, we are required to provide certain paid leave benefits, including to somebody who is taking off because they're getting diagnosed with COVID-19.
Okay.
And it's much more complicated than that, but I'm saving everybody the details. But hey, I'm free if you want to give me a call. Certainly willing to answer those questions.
It's more complicated than that. You had me at hello. I tried to follow that Venn diagram and
it's very confusing, yeah, but manageable.
So the workspace environment. Coincidentally, I was talking with somebody recently who was saying that they were configuring their workspace and they're going with all open after this COVID. They're going with open floor plan.
Interesting.
And I said that sounds contrary to what everybody else seems to be saying or doing, with putting up dividers. And they said no, they want to make sure there's more fresh air. And Tina, where do you see but let's start with office environment. My daughter does real estate appraisal, and she was talking about where they see retail and office going. But where do you see not just the office environment usage? Do you see it spreading out more now? Do you see it contracting because more people working from home, and the office design?
I mean, I see a temporary, and this is my personal opinion only. I see a temporary contraction in the workplace, but not a reduction in square footage. I think what's going to happen is we're going to go back to the 1980s where you had individual offices for executives and you didn't have these open bullpen spaces where you had, easy contamination across cubicles. Because even if you're in a cube open air environment, you still have the dividers up, the air is still flowing. I think what we're doing from a building standpoint is just bringing more fresh air into the buildings, making sure you bring in as much fresh air as possible every hour on the hour, or as much as your system allows, making sure the filtration systems have proper filtration, filters in them. They talk about MERV 13 and 14 filters. If your system can accommodate the highest level of filter, putting those in as well. So making sure you're getting in A, fresh air, and B, filtered air.
Interesting, because I know people who work with, excuse me, office furniture, and I don't know if they're what they're hearing. I haven't spoken about it lately. If there's going to be a lot of modifications, I know that we put in cubicles, and we originally had the 5-foot panels or 6-foot panels. Now we went to the 4-foot, 3 or 4-foot panels.
Now everybody's going to go back to the 6-foot panels, or at least the see-through panels. I mean, people are reducing occupancy in the space. So if you have these open air environments with cubes all over the place, they are moving every other seat, making sure there's proper social distancing being practiced and 6 feet between all of the cubes. They're reducing occupancy in the conference rooms, reducing occupancy in pantries, either closing down or reducing seating in cafeterias, fitness centers. I mean, think about all the amenities that you have in a commercial office building. Now all of that is going to be cut in half. However, I think that there's going to be push, I think people are going to be excited to get back to work. They're going to be excited to resume some measure of normalcy in their lives. They're going to start interfacing again, and then they're going to drop that wall of fear at some point. And I think that there's going to be a push to the suburban areas, so all of the areas right now that are really hot spots in the city or along the waterfront or Jersey City, I think that you're going to find tenants are going to move back into Parsippany that has a high vacancy rate, down to Princeton, down to Bridgewater, down to Woodbridge. It'll be interesting to see what happens, but I think de-densification is going to be a big thing for 2021.
Interesting. And do you see anything different within industrial, light industrial?
I'm not sure light industrial will be affected as much. I mean, New Jersey has so much industrial and flex warehouse space, and I think it's just going to continue to grow, especially given the demand of shopping from home. I think that all of that is going to just continue to grow.
I think at this point we're going to probably be repurposing the malls to something else, and some other use. I'm going to run one last poll real quick, and then we'll get to some closing questions. I will tell you, I think that everybody's scared because I'm reading some comments, and I'm going to be in trouble because somebody asked a question. You'll hear who it was, and I couldn't understand their question, but it was Alan Sobel, so I think it's okay. He typed a word and I responded to him asking what he was saying. So Alan, I'm saying to you, what were you saying? What best describes your organization return to work plan intentions? Anyway, remember these polls are just to get some information and also make sure you're still on. Couple questions looking real quick. Does the real estate industry, what do you think? Office space, we discussed already. Question for Justine. What do you think the most significant, I guess this could kind of almost be your parting comment. What is the most significant potential legal exposure for a company that may or may not be able to practically comply with returning to work guidelines? John was wondering that. Yeah, that's a tough one.
My very lawyerly answer is it depends. It depends on what industry we're talking about. It depends on how many employees you have. It depends on a whole host of factors. What I can tell you is about the litigation trends right now. The most obvious to most of us is workers' comp, and that goes back to if an employee contracts coronavirus at work, or I'm sorry, if an employee contracts coronavirus, is it an occupational disease, meaning can they trace it back to work? And the more safety precautions and safety measures and infection control strategies you put in place, and the more notice you give employees about it, meaning you have airtight written policies that you've partnered with your lawyer to write, the more of that you have and the more effort you put forth, the less exposure to liability you're going to have. And so when I said workers' comp, I meant any case involving like an OSHA citation, workers' comp, somebody wanting to refuse to return to work based on unsafe working conditions. The more safety precautions you have in place, and the more notice you give employees about what they are and what those employees are required to do by giving them these policies, potentially making them go through an online course at home before they return to work, the more you have showing that they understood these policies, that they were given notice of these policies, and that they're required to follow these policies, and that you enforce those policies, right? The better off you're going to be. That's a better angle to attack that question than to say, what's the most likely cause of action? Because frankly, Brad, there are so many causes of action that are on the horizon that we don't even know the name of right now. For example, Alan Shore, who's a plaintiff's attorney in South Jersey, where I grew up, he actually was one of my professors back in the day in law school, one of the smartest guys I've ever met, thinks that because of the enhanced unemployment benefits that are available to employees right now, they stand to take a pay cut if they come back to work for lower wage earners. And so they want to stay home. They want to refuse to come back to work. And one of the causes of action that might be on the horizon is called wrongful retention. So why did I bring employee A back and not employee B? Employee A and B have the same job title. Why did I bring A back and not B this week? If the answer has anything to do with age, gender, sexual orientation, or any of those protected classes, you and I both know, Brad, that the reason you brought employee A back has nothing to do with those reasons. But employee A may find, because he or she stands to make more money off the job, has motivation to find that reason, to come up with his own reason. So the more you have in place to show, no, I brought employee A back because employee A has 5 years seniority on employee B. I brought employee A back because the documented numbers showing employee A's production, right? Employee A is more productive than employee B. As long as you have those legitimate non-discriminatory reasons for making those furlough and recall decisions that you're making, you're going to be better suited when this new, quote, wrongful retention cause of action, as Alan Shore coined it, comes up and is tested in the courts.
Eric, that scared me. Do you have anything medical that we can close
Good,
on?
that's my job. Scare employers, scare them.
Tell me something medical. Tell me that this virus is gone and life is great.
Oh,
and I
that'd be
can
fantastic. Yeah, so again, positive note, and I do think this is secondary to the social distancing, and I like to call it physical distancing because you can still be social without physically present. Definitely has taken a significant decline. I'm hopeful that despite what has been going on, in regards to protests and beaches opening up, that we continue to see, at least it doesn't have to go to zero. What we need is the ability to treat people without overwhelming the healthcare services. And right now we've pretty much gotten to that point. So as long as things stay status quo and/or continue to improve, hopefully more people can return to work, enjoy seeing their friends, etc. But we'll see what the next few weeks to months hold. But the one big benefit of this, if you have to have a silver lining, is moving forward. I think we're going to see a significant decrease overall of viral respiratory illnesses, just because people are going to be that much wiser in regards to how to protect themselves. So hopefully we have a better flu season out of this.
Now I actually do feel better, because I agree with you. I think that people are going to be more attuned to the hygiene aspect and think
Right.
about things more, including myself, and not walking right into a hotel and just grabbing the remote and putting on ESPN.
Yeah.
Ah.
To quote Spike Lee, just do the right thing.
Right. Tina, you have any closing comments for us?
I think that I feel badly because we didn't answer a lot of the questions that I think were posed in advance of the meeting. And I just wanted to say that I'm happy to offer a brief PowerPoint to those who may have additional questions on reoccupancy that you can circulate. They can email me directly, or they can go directly through you or Colleen. But some websites that are very good for everybody to go to, obviously cdc.gov. You have BOMA, the Building Owners and Managers Association, boma.org/coronavirus. There's a great deal of information there for tenants and their employers. COVID-19.newjersey.gov, COVID-19.newyork.gov, lots of valuable information there, all stored in one place. REBNY New York, REBNY.com. And I can rattle many more off, but I won't bore you with that.
Yeah, and I appreciate your comment, Tina. This is something that people should be working on, and not just with an hour webinar. You should have a team, if you can have a team put in place to get the return to work program rolling, and don't just have people running back to the office. Think about everything that these professionals have recommended.
Yeah.
I strongly recommend you reach out to them in an engagement capacity where possible. Dr. Eric's going to be harder to engage, because then it means you're in the emergency room potentially. I don't know if I'm advocating that, but I will put up their contact information one more time. Justine, did you have a comment? It looked like you were pointing at me. No?
Yeah, you know what, I did. I also wanted to say, I know I brought up some of the claims that could manifest. I know that a lot of folks on the webinar right now are PPP loan recipients. And so another important step that you really should take, and this plays into employees who are refusing to come back to work because they stand to make more on unemployment, or because they just want to stay home, don't feel like coming back to work, and they're hiding behind, quote, unsafe work conditions. Have a written offer of work sent to these people and document their responses. We know that under the PPP, we're going to suffer a penalty to our loan forgiveness amount if our full-time equivalent employee numbers are reduced. So if an employee refuses to come back to work, refuses a recall offer, not only does that generally make that person ineligible to continue receiving unemployment, but it would affect your FTE numbers. So all of a sudden you have one less employee. There's an exception to that if there's a written offer of work, which should be carefully drafted with your lawyer. Call your lawyer to draft it. Don't go to LegalZoom. Don't get it off Google. Call your lawyer to draft that thing, because it's so important. And document the employee's responses, and make sure that that written offer is for the same job, the same hours, the same wages. Right. That was because I know we have a lot of PPP loan recipients, so I did want to make sure that I slipped that in there, perhaps untimely, but yeah, thanks for giving me that chance to say that.
Don't worry about it, because next week we might be bringing back PPP, so thank you for teasing him. That's like the trailer. But I want to thank everybody for attending. I'm sure there are a lot of questions. We will provide your previous questions and the questions we got today to the presenters, and where they can get back to you, they will. Hopefully you gain some information, but this is not something that you should just stop with this 1 hour webinar. Eric, Tina, Justine, I appreciate all the information you provided. Scared me. I was ready to go back to work. I don't know if I am now. Like, I don't want to be in my house. I just want to go into a bubble somewhere. No, be safe. Be safe, communicate, and think smart. It's the best thing to do. So, but my wife works for a doctor's office too, so she's always yelling at me. So, good luck with everything. Thank you again.
Thank you.
Thank you.
Thanks for having me.
Fantastic. Yeah, thanks for the invite. Appreciate it.
Thank you.
Have a great day. Stay well.
Be safe.
Goodbye.